Did you know that some Medicare plans can actually put money back into your Social Security check? It's a question I get all the time here in the Valley. It's called the Medicare Giveback, and a lot of people here in the Rio Grande Valley don't even know it exists or how it could help them. I'm Antonio Espino, and today we're going to clear up the confusion and explain exactly what this benefit is, and more importantly, what it isn't. Simply put, the Medicare Giveback is a benefit offered by some Medicare Advantage plans that helps reduce your monthly Part B premium. Now, let's clarify a few things right away. This does not mean Medicare is free, and it doesn't mean you get a check mailed directly to your house. What it actually does is reduce the amount that is automatically taken out of your Social Security check each month to pay for your Part B. So instead of paying the full standard premium, the plan pays a portion of it for you. It's like getting a monthly discount on your healthcare costs. This benefit has been around for a while, but it's become much more popular recently as plans look for ways to offer more value to their members. In fact, about a quarter of all Medicare Advantage plans now offer some level of Part B premium reduction, though the amounts can vary quite a bit. So, how does it actually work? First, you have to enroll in a specific Medicare Advantage plan that includes this give back benefit. Once you're in the plan, that company notifies Medicare that they will be covering a portion of your Part B premium on your behalf. Medicare then adjusts its records, and the Social Security Administration updates the amount they deduct from your monthly check. It usually takes a month or two for the change to reflect, but once it does, you'll see that extra money staying in your bank account every month. For example, if your Part B premium is around 200 and your plan offers a 50 give back, you'd only see 150 deducted from your check. That's an extra 50 a month or 600 a year that you can use for groceries, utilities, or whatever else you might need. But here is where it gets a little tricky. In areas like Brownsville, Harlingen, and McAllen, availability of these plans can change every single year. Not all plans offer this benefit, and the amount varies based on where you live and which specific plan you choose. There are also strict marketing rules. You might see ads for huge givebacks, but those specific amounts might not be available in our local zip codes. That's why it's so important to have a local expert who knows the RGV market to help you find what's actually available to you right here at home. The pros are pretty clear. Lowering your monthly costs and having extra money in your Social Security check is a huge win for many seniors. It provides that extra bit of budget flexibility that can make a real difference when you're on a fixed income, but there are trade-offs to consider. One of the biggest cons is that these plans might have tighter doctor networks or higher copays for certain services to offset the premium reduction. It's possible your favorite doctor or local hospital isn't in the plan's network. You never want to save 50 on a premium only to pay 500 more for a surgery. You also need to check the drug formulary. If the plan doesn't cover your specific medications well, the give back might not actually save you money overall. The goal is to find a balance. The give back is great, but it shouldn't be the only reason you choose a plan. We have to look at the whole picture. Who should consider these plans? Usually people who are focused on lowering their monthly fixed costs and are comfortable using a specific network of doctors. If you're relatively healthy and your doctor's already in the network, a give back plan can be an excellent way to keep more of your hard earned money. But I always emphasize it's not always the best option for everyone. Every situation is unique, and what works for your neighbor might not work for you. Here in the Rio Grande Valley, I help my clients compare these plans side by side to see if the Part B premium reduction is actually worth it based on their specific doctors and medications. If you want to see if you qualify, call me at 9564551313 or click the link below. And don't forget to subscribe for weekly Medicare updates. I'm here to help.